We are going to start today the series containing oral placement therapy techniques, and the first part today will discuss Chewy tubes. These are made of thermoelastic polymer and they are latex-free and lead-free, so feel free to put it in your mouth and practice functions of biting, chewing, and also improving sensory experience. How do these Chewy tubes work? They improve the tone and strength in the muscles of the cheek that help in closing the jaw while chewing. They provide a sensory stimulation known as proprioceptive stimulation to the jaw joint. If a child or anybody has a sensory experience in the mouth which is not comfortable, making them uncomfortable with different kind of textures of food in the mouth, or even the feel of a spoon, they can help in relaxing that. They can also aid in movement of the tongue from left to right and right to left. The technique of use of Chewy tubes is they are supposed to be held between the molars, which are the cusp-like teeth at the back of the mouth. So you hold them between the molars and release and increase the time of hold as you go. And if you try, second way is when you try to hold it and the other person tries to pull it out of a mouth, it's like a resistance training for the jaw. Let's talk about the different kinds of Chewy tubes that are available. First category, we have the yellow tube. It is a T-shaped tube. It is the smallest one. So as we can see, it is quite soft and can be used from 9 to 10 months up to 2 years of kids. So for infants, it's really good if you do want to develop that function. And if it's such young kids, we can of course understand that it will really help in mouthing experiences that children have, as well as for teething troubles. The second one is the red colored one. It can be used in 2 to 3 years old. The green tube is a special one because it has textures. So it is very good for oral tactile stimulation, and of course we can find that it can be useful in children who have autism. So for curbing their oral sensory needs, it's really beneficial. The blue one is the hardest one, or we can say the most firm one, and it is mostly used in adolescents and adults and helps in providing a strong jaw strength. Two specific orange tubes are also available, which are in P and Q shape. The Q shape one is round all along with stem that you can hold, so it can be used bilaterally on both sides at the same time. And the P1 happens to have a short stem, so that if any child or any adult tends to have gagging kind of sensation or there is too much oral defensiveness, it keeps it slightly in front part of the teeth and thus avoids gagging. There are two specific tips for use of Chewy tubes either with adults or with children that try to keep it clean. So wash it with mild soap and water after each use, which is very important. And secondly, as soon as you see any signs of wear and tear, try to change it. Make sure that you know what is the extent. You can discuss with your therapist what is the extent for which you need to apply it, and they will recommend the best tube for you. Hope this was an informative video for you. Mention in the comments below. Give me any more suggestions that you might have for this channel. We'll meet again soon.